And tonight I'm focusing on the topic of neural networking, and the title is Breaking the Circuit. So I'd like to thank Mr. Mark Murphy, a patient of mine for a number of years, who inspired me to have this subject matter tonight. I saw him this week, first time in about a year, and I'm going to share his testimony and his tip for you, the audience, and how can we become masters of pain. It's something that I've managed to achieve with my chronic knee pain and chest pain over the years, and I'm happy to agree exactly with what he's saying. Well, let's go back a few years. Mr. Murphy came into my office and I had an evaluation of his chronic pain, and I explained to him pain is a disease of the brain that we can change if we have a different mindset and belief system. And what was remarkable about Mark was he had chronic back pain for many years. He was on narcotics like many other patients, but he was ready to hear the message I had from that day, because not only had he mastered cancer and chronic kidney disease and failure on dialysis in the ICU, he actually had recovered from both of these situations. The cancer, he was told 10% success rate or chance of survival, and he made it. And he already knew what it was to use a mindset and a thought process, a belief system, which he could turn his life around and radically change it. So on that wonderful day that I met him, he was so ready to hear this, and it was amazing because the night before he had been watching a YouTube or Netflix video, something like Heal or one of these shows that were just talking about neuroplasticity of the brain and how we can literally change our brain and change our experience. So when I started to talk about this with him, he just felt right, that I feel connected. And amazingly, that day, he says, I don't want your treatment with trigger point injections, which is quite unusual. He says, I know what you're talking about, and I know what to do. So off he went, and he came back to touch base with me, and he says, you know, by the time I got to my car, which was literally seconds away, he was able to put his back pain to a different place, literally, and he had no back pain. Now, he didn't manage to maintain that, but that was an experience, and he described it as, Wayne, you got to break the circuit. Just break the circuit. And when you think of the billions, and I mean billions of interconnections in our brain that are all electrical impulses, then if we can get the concept that we can literally break a circuit, and we do that by creating another circuit, and that's what he's been doing for several years now. And you know, he just came in to see me, as I said, this week, and he says, no, the biggest pain I have is when I miss a 6-foot putt. Oh, my heart bleeds. But he was able to play golf 18 holes without back pain anymore. And several years later, he's successfully been off his narcotics from a regular basis. In fact, I think he's not been using them for about 6 months in any capacity. And he's really mastered this thing called neuroplasticity because he believed in it, and he also had experience. And I think for him, because he was able to change his mindset around cancer and kidney disease, it wasn't too much of a jump to do that for pain as well. So, and that's what he was saying, you know, Mark is a master of this. And I've met several patients down the road who are true masters of their pain, and they can honestly say that their pain, if it comes back, they can stop it, or it just simply doesn't come back anymore. And you know, you may be thinking, well, that's just not possible. Like, how can that even be my experience? Well, it's important to listen to the people who have mastered things, and we can learn things from them. That's my heartfelt belief. And you know, it's a long journey to get there. And you know, Rome wasn't built in a day. We need to take our time, but we start with basic principles. And you know, as I was talking to Mark about, well, how could we utilize this knowledge that you've got into everyday practice, everyday life with you, the audience? And it just came to me when we were talking about it. You know, he says, you know, when we're distracted, we don't have pain. And just think about that for a moment. If you're distracted doing something you love, or maybe not love, but you're distracted. I had a patient today who had an awful experience in the vet, and his pain went away when he went to the vet. So we were talking about that again. So basically, something's happening in your life, the pain's gone. So for that moment in time, you're experiencing a break in the circuit of pain, because you don't experience it, you're distracted. So what we could do in our daily life is that when we are pain-free or pain, much reduced, say pain 1 or 2 out of 10 versus an 8, 9 or, a high score, we could just say break the circuit, break the circuit. And what we're doing there is we're associating a thought with an experience. And my encouragement to you is not only have the break the circuit word spoken aloud and the experience of no pain or very little pain, but apply your heart at that moment and just feel good about the fact that you're breaking the circuit right now. Because when you attach a positive feeling with an experience and a positive thought and a positive word statement, you are creating a healing environment for your body and for your brain. So if we were to do this every day, say once a day, 365 days a year, in 3 years' time, 1,000 different times you've experienced joy, positivity, positive word statements, and a reality of much pain reduction, your brain will be radically different. And maybe, only maybe, you too will become a master of your pain. So that's my message tonight. Let's get involved with this reality that Mark has experienced. I've experienced it as well, both chest pain and knee pain over the years. And this is how I deal with it. I have a laugh when my knee pain comes on. If I'm out running, I just say go away. And because my brain has been programmed enough, that's how it works. And it's just like riding a bike. Once you learn to ride a bike, you can always ride a bike. Once you learn to master pain in a certain way with certain neuron networks, you're going to master your pain. So give me some advice back on this video tonight. I really appreciate that. Leave a comment on the comments there. I'll say hi to the people who have joined me. It would be great to hear your feedback, or give me a question of another subject matter on the realm of chronic pain that I can maybe talk about. I look forward to hearing those comments. So I'm going to bow out now. I'm going to go and have another video for my colleagues in the field who are part of my Facebook group, private group, and I'm going to shed some further light on some pearls that I've been learning this week in my office. So listen, thanks for joining me. It's great to be here. I'm glad you've listened to this to the end, and I welcome you back another week's time. Okay, thanks so much and take care.